Welcome to Dr. Balaga's God Knowledge Doc podcast, your quick dive into the latest medical breakthroughs to keep you ahead of the curve. Let's get started. Today is April 20th, 2025. This video is on a recent Lancet article published online on April 16th. It's regarding the efficacy and safety of topical Delgocitinib, a JAK inhibitor, versus oral Alitretinoin capsules in adults with severe chronic eczema, a 24-week randomized head-to-head phase 3 trial. The acronym is Delta Force. Chronic hand eczema is a disabling inflammatory skin disease with significant quality of life impact. Topical corticosteroids are first line but inadequate in severe chronic hand eczema due to side effects like atrophy. Alitretinoin is only systemic therapy approved but has tolerability issues. Delgocitinib, a topical pan-JAK inhibitor, shows promise as a non-steroidal alternative. Methods to the randomized SSR-marked head-to-head phase 3 trial, 102 centers in 10 countries, 413 adults with severe chronic hand eczema were enrolled. Delgocitinib cream, 20 milligrams per gram twice a day versus Alitretinoin, 30 milligrams once a day for 24 weeks. The primary endpoint was a change in HECSI score at week 12. The HECSI score is a standardized clinical tool used to quantify the severity of chronic hand eczema. It combines both the intensity and extent of the disease. What were the findings? Greater reduction in the HECSI score with Delgocitinib versus Alitretinoin, p-value 0.0001. More patients reached HECSI 90 with the Delgocitinib, 39% versus 26% with Alitretinoin, and more patients reached the investigator's global assessment for chronic hand eczema, 27% versus 17% in the Alitretinoin group. There were fewer adverse events with Delgocitinib, 49% versus 76% in the Alitretinoin group, especially headaches and nausea. There was a better dermatology life quality index improvement and symptom relief from week 1 onwards. Key takeaways: Delgocitinib showed superior efficacy and safer over Alitretinoin, effective control without systemic or corticosteroid-related side effects, early response by week 1 and sustained through 24 weeks, promising topical alternative for severe chronic hand eczema with unmet needs. The accompanying commentary highlights Delgocitinib's potential as first topical option in severe chronic hand eczema because of fewer adverse events than Alitretinoin, avoids systemic toxicity and teratogenicity. The limitations of the trial: not double-blinded, underrepresentation of non-white populations. The commentary recommends further study in diverse phenotypes and ethnicities with molecular phenotyping. Podcast brought to you by Master MedFacts at mastermedfacts.com.